Do not shake a baby. Shaken baby syndrome, also known as abusive head trauma, is a serious brain injury that occurs when a baby or young child is violently shaken. What happens during SBS? Shaking causes the baby's fragile brain to move back and forth inside the skull, which can lead to bleeding in the brain, also known as subdural hematoma. Also, bleeding in the eyes and swelling of the brain can seriously cause permanent brain damage, paralysis, blindness, or even death. So why do people shake a baby? It's almost always out of frustration or desperation, not particularly malice, but most commonly because they are overwhelmed by the baby's persistent crying and don't know how to cope. Most cases involve parents, babysitters, or caregivers, often during the baby's first few months of life, when crying tends to peak. This brings me to the crying curve, also known as the purple cry. The crying curve refers to the normal pattern of increased crying in infants during the first few months of life. Rest assured, it's part of healthy development and happens in babies around the world regardless of parenting style or culture. I'm sure we all know by now crying is the language a baby speaks. Basically, that is how they communicate. And so, it is absolutely normal that a baby cries. Now, what can you do when your little one hits the purple cry? The only person here that can control the situation is you. Yes, you, the caregiver or the parent. So, first, check for basic needs. Make sure the baby isn't hungry or needs to suck, has a wet or dirty diaper, is too hot or too cold, or is tired or overstimulated. Try some calming strategies. These are safe, evidence-based soothing techniques. First, swaddle. Wrap the baby snugly in a light blanket, with arms in and legs loose. Many newborns feel more secure this way. Next, find some calming strategies such as holding and rocking. Hold your baby in your arms and gently rock back and forth, walk around the room, or use a baby carrier or sling. A carrier or sling also gives baby that sense of closeness, and they know you are present and close. White noise can be really effective. Play soft background sound like a fan, vacuum cleaner, white noise machine, or an app. Give some soothing touch. Rub or pat the baby's back, offer a pacifier if they take one, and try skin-to-skin contact. Now, number 5, change scenery. Sometimes a change helps. Go outside or to a different room, take a short stroller or car ride. Now this last tip could save us all the drama. Tip number 6, burp your baby. Often trapped air can be uncomfortable for baby, and the release of gas could be all that they needed. And so, more burping. Thank you for sticking around. Please like, comment, and share this video with the parents of the crying baby next door.